With the defeat of the GOP health bill, Republican infighting has come to the fore, with a number of states now considering expanding Medicaid programs under the Affordable Care Act. Kansas's GOP governor on Thursday vetoed a Medicaid expansion after its GOP-led legislature voted Tuesday to expand it to cover more than 150,000 additional non-disabled adults. Joining us now to discuss is WSJ national politics editor Aaron Zitner in Washington, D.C. Welcome, Aaron. Great to see you.
Hi, Tanya.
So, Aaron, House Speaker Paul Ryan is expected to speak shortly and touch on health care, but he did say Friday we're going to be living with Obamacare for the foreseeable future. And Health and Human Services Secretary Tom Price said Wednesday he's obligated to uphold it as long as it's in place. So are most congressional Republicans and Republican-led states now resigned to Obamacare?
Oh, not at all. And there are some big questions on the table for the Republican Party. So Obamacare is with us. A lot of people rely on it, but it has problems. Premiums are high in many cases, and a lot of places only have one insurer available within Obamacare offering policies. There's not the competition you need to keep prices low and not a lot of choices for consumers. So Republicans have a choice. Do they shore up this law and improve it and make it work well? Or do they take steps that are within the power of Congress and within the administrative authority of the Trump administration to knock down the law? The president keeps tweeting that Obamacare is going to explode. In one tweet, he said it would fold. Is he going to help make it explode? Or is he going to shore it up since it's the law that so many people rely on?
But, Aaron, several states are now moving forward to work within the system as it stands, even moving to expand Medicaid?
That's right, to expand Medicaid, which is the largest health provider. It's 1 in 5 Americans are on Medicaid, and you see a Democratic-led state like Virginia step forward, and some Republican-led states like Kansas and North Carolina take incipient steps. You mentioned that it didn't ultimately move forward in Kansas, but the states have the impulse to expand Medicaid under the law. But we have this shadow hanging over the law. The Trump administration, for instance, could undermine the law by taking the penalty that we impose on people for not buying insurance, the so-called individual mandate. It could undermine the individual mandate by setting the penalty for not buying insurance to $0. That would mean a lot fewer younger, healthy people would be buying insurance, and it would destabilize the risk pools, leaving a lot of older and sicker people in the risk pools. They could also cease payments that the insurers need and have agreed to, the government agreed to pay them under Obamacare. It's called the cost-sharing formula. It basically reimburses insurers for taking sicker patients. If those payments cease, again, that destabilizes the market. So any state moving forward has to do it under the umbrella of this uncertainty.
Right. Now, at this point, though, Aaron, there is no serious new health care bill on the table, is there? And if there were to be one, is there any evidence that the White House is reaching out to Democrats to sort of ease the party line vote?
Well, you saw Donald Trump even today say, if the conservatives who helped undermine the Republican bill don't get on board, I'm going to go work with Democrats. But we were just, some of us at the WSJ, on the Hill this morning talking to Democratic leadership. They say there's no sign of outreach yet from Donald Trump, so they haven't seen it. And Republicans are still trying to find a way to bring this bill forward in new form with just Republican votes. And that remains still a tough task, just as it was 2 weeks ago.
All right, Aaron Zitner in Washington, D.C., thank you so much for that insight.
Nice to be with you.